Let's get a real nice look. Already you can see the difference just in her standing posture. You can see, so this is the superior angle, this is the lateral border, this is the inferior angle, right? So you can see a certain amount, and then here is the spine. So superior angle, you feel this is the spine of the scapula, and then at the top right here, your acromion, right? So here, you can see the same thing here. So she's got a certain amount of weakness. She's left-handed. Aren't you left-handed? But she's got a little bit more droop on this side. Right? You're looking at just posture, right? So we're gonna do thumbs up, elbow straight, whatever you can touch, and you're just gonna go up nice and slow. Alright. You're looking for scapular motion. You're looking at the inferior angles and how abducted the scapula is and where the medial border is. You're gonna look at the sulcus signs of the shoulder, and you're gonna look at the elbows. Elbows play a role, but you see how abducted, abducted this one is? Okay, go ahead and bring it down. All right, so here you can see the spine. So you're gonna see the rhomboids are right here. You're gonna see the supraspinatus, the infraspinatus, or teres minor. You can't see teres majors on top. Go ahead and lift it up one more time. Go nice and slow. You're gonna see that coming out. So it's a little too far abducted, right? And then she's a little tight here. So if I were to take that shoulder blade and actually put it where it's supposed to be, she's lost motion. So her capsule is very tight in a very particular spot. Usually it's posterior and inferior capsule tightnesses. Go ahead and bring it down slowly, and you're gonna see that she cannot keep her scapula pinned to her ribs, right? So if you come from the side, you're gonna see, I mean, as fit as she is, you're always looking from the side, and when she moves, she tends to let her ribs go. So if we look at the spine, we're gonna pull her ribs in just a little bit, but pull her shoulders back, right? And then now, look at her, bring your arms. Okay, so more effed up than we thought. No kidding.
Listen, you're on something.
Listen, I'm just jealous because no one can wrap their hands around my ribs like this. All right, go ahead. Bring your arms up. Bring it up. Come look from back here. All right. Keep your elbows straight. Right. Yeah, you feel that?
Oh yeah.
And then bring it down. Come from back here, and you're gonna feel the difference, right? So I'm gonna keep her ribs down. I'm gonna cue her, right? So go ahead and bring your arms up. Right, so she's, all right, and then come back down. So she's got some tightnesses in probably most likely the capsules, and then some imbalances and weakness of certain muscles here. You can see the rhomboids are powered up, especially on this side, probably compensating for other muscles that are not moving as well. And then this one, you can see the rhomboids here, they're fine, but it's usually the serratus anterior, which you can't palpate because it's the muscle that holds the ribs, holds the scapula. So it goes from the ribs to the inside of the scapula here, and it holds the scapula to the body. So that muscle is not firing enough, right? And then remember, we talked about your upper traps, your middle traps, and then your lower traps. So those probably are not pulling enough to keep her in a certain position, right? Because she keeps getting pulled downward versus upward. Because the muscles in the front, talked about pecs major, pecs minor, they kind of pull it downward, the acromion, right? The scapula, or the AC joint, SC joint in the front. But this is just an example of how when you're looking at someone, you're going to look at their scapular motion to their humerus bone to the muscles in the front. So you have to always put together posterior muscles, rotator cuff muscles, and then the anterior muscles that we discussed when you're evaluating shoulder.